Welcome to Midwest Physical Therapy. My name is Kim Knopik, and I'm here today to talk to you about common shoulder conditions and things you can do to help manage them. In order to understand the different conditions of the shoulder, you must first understand the anatomy of the shoulder. When you look at the shoulder joint, it is made of two bones, the humerus, which is this long bone here, and the shoulder blade. The humerus makes up the ball of the joint, and the shoulder blade contains the socket. Another important bony projection is the acromion, which is the bone on the top of the shoulder. Another important structure of the shoulder is the rotator cuff. The rotator cuff are four muscles that run from the shoulder blade that attach to the humerus. They provide motion to the shoulder and also stability. There's also an important structure called the joint capsule. The capsule is a sleeve of tissue that runs from the scapula to the humerus and helps hold it together. And finally, there's something called the labrum. The labrum is a rim of cartilage that runs around the socket that deepens the socket and provides additional stability. So why do people commonly injure their shoulders? The most common reason is due to overuse. It can be due to overuse at work, from lifting or reaching repetitively, or it could be overuse at sports, particularly with throwing athletes or athletes that do a lot of overhead motions. The second reason people injure their shoulders is due to trauma. Oftentimes people fall and land on their shoulder or perhaps dislocate their shoulder. Both of these scenarios are common reasons for shoulder injuries. There are four common conditions we see with shoulder injuries. One of the most common is shoulder impingement. That's just another word for pinching of tissue. Basically what happens is as the humerus comes up, soft tissue gets pinched between the acromion and the humerus and causes inflammation, both to the tendons and to the bursa. The next common condition are labral tears. The labrum, as you remember, is that rim of cartilage that deepens the socket. With overhead throwing athletes, they oftentimes can tear the labrum. The next common condition is adhesive capsulitis. That's another word for frozen shoulder. In this condition, the joint capsule becomes rather thickened and adhered to the bone and prevents shoulder motion. This is a particularly painful condition. And the final condition is rotator cuff injuries. There can be rotator cuff tendinitis, where the tendon is just inflamed, or there can be tears in the rotator cuff. So what should you do if you start to notice pain in your shoulder? First of all, you should try to rest your shoulder. Try to identify those activities that are irritating your shoulder and avoid doing those as much as possible. Secondly, you could ice your shoulder. We advise putting ice on your shoulder for 15 to 20 minutes at a time, 2 to 3 times a day. Next, avoid sleeping on that shoulder. When you sleep at night, sleep on your back or on your good side with a pillow under your arm to support it. You also might think about your positioning at work. If you work on a keyboard, make sure your keyboard height is equal to your elbow height. Next, you could do some exercises for your shoulder. You could do gentle range of motion exercises like pendulums, where you hold onto a table, lean forward and swing your arm in circles. Or cane exercises, where you use a cane or a dowel to stretch your shoulder upward and outward. Next, you could do some strengthening exercises. We recommend strengthening the muscles between your shoulder blades and your rotator cuff by either using a weight or a light resistive band. If you have tried all of these activities and you continue to have shoulder pain, it may be time to seek medical attention. We would be happy to work with you here at Midwest Physical Therapy. Please stop by or call us at 402-436-2535. Thank you.